The fast action of the trading pit to the power brokers making the headlines. You'll hear it all on the Traders Network Show with your host, Michael Yorba. All right. Michael interviews the front page titans about the latest in trading tools and market trends in stocks, commodities, bonds, forex, and derivatives. The Traders Network helps you stay ahead of the curve and delivers tomorrow's trade today. Now, here's your host, Michael Yorba.
Welcome back to the Traders Network. I'm Michael Yorba, your host, broadcasting to you live from the Dallas KFXR 1190 AM iHeart Media Studios. And my first guest today, Kevin Conroy, Chairman, President, and CEO, Exact Sciences. This gentleman brings a huge, huge benefit to mankind in what they're doing in the way of finding out early on cancer that actually it's near and dear to my heart. It's something that happened to me and my close family recently. Kevin, welcome to the show. Appreciate you being here.
Michael, thanks for having me.
All right, my pleasure. Tell us a little bit about yourself, your background, and let's get right into what Exact Sciences does and how it really, really helps humanity.
Sure. Well, I have been in the business of early molecular detection of cancer for the past 6 years, and before that I ran a molecular diagnostics company broadly focused on diagnostics, but came here with the passion to help find what is probably the closest thing to a silver bullet in the cure for colon cancer, and that's early detection. Over the last 5 years, we focused on bringing Cologuard to market. It is now FDA approved, and Medicare covers the test. And we couldn't be more excited about making this incredible new technology available to people over the age of 50 throughout the U.S. and around the world.
Well, you're not the only one because your stock has just taken off to almost a parabolic move, and it's just been amazing. Tell everybody the symbol. Let's get that out here early.
EXAS, like Texas without a T.
All right, that's a good one. All right, let's drill down into Exact Sciences. What does it do, and how have you been able to help so many people?
Yeah, so Exact Sciences' mission is to play a role in the eradication of colon cancer. That may sound audacious, but it's actually achievable with effective screening by detecting colon cancer early in the precancerous polyp stage or in the early cancer stage. You can either prevent the disease or cure it. Early colon cancer is almost entirely curable. Late-stage colon cancer, only about 10% of people survive. So with our test, Cologuard, a patient provides a stool sample in the privacy of their own home. That sample is returned through UPS in a safe container, and that sample is analyzed for very specific DNA markers and a protein called hemoglobin. And if any of those markers are present in a sufficient quantity, then the patient report is positive, and the patient's physician will ask them to proceed to get a colonoscopy. So the idea is detect early through these simple biomarkers that are shed from the problem area into the colon, detect them, and get the patient in to get a colonoscopy where the problem can be identified early. It's really a simple concept. It's just taken a long time and a lot of great minds to turn it into reality.
Yeah, well, you've got some great minds on there. Give us an idea, or just a high-level view, if we can, because we only have so much time today, and I could spend a day with you on this. Talk to us about the team, the brilliant people that are surrounding you with your company that's helping to because your stock has just absolutely gone parabolic, and so somebody's taking notice of this.
Well, this started with Dr. David Ahlquist and from the Mayo Clinic and his team of researchers who have focused on this problem for a long time, and then coupled with the team at Exact Sciences, Dr. Graham Lidgard, who has a 40-year career in developing advanced molecular tests. And we put this together with a terrific team of people to build a test, Cologuard, and actually take it through a 10,000 patient clinical trial that was published this year in the New England Journal of Medicine. It was a real team effort, and it was a team of terrific people who brought this to patients everywhere.
All right. You brought up Cologuard. Let's talk about that. What is it, and how does it work?
So Cologuard is a simple at-home test. Your doctor orders the test for you. It's for people between the ages of 50 and 84 that are at average risk for colon cancer. So if you have symptoms, you should go have a colonoscopy performed. If you are asymptomatic with no symptoms, the doctor orders a test, a collection kit goes to your home, you provide a sample, you return the sample in a collection kit, it gets analyzed, and a patient report is generated and sent to your physician. It's a really simple test. It has been shown to detect 92% of all cancers, which is an incredibly high detection rate for any cancer screening tool, and is highly specific with only about a 10% false positive rate. So this Cologuard was approved by FDA and covered by Medicare nearly simultaneously, which is the first time in history FDA and Medicare have acted in concert. It is a really simple, easy-to-use test, very patient-friendly.
Market penetration. How many physicians are now becoming aware of Cologuard, and where is that headed?
Well, upon launch, we deployed 120 salespeople to reach primary care physicians, large group practices, hospital systems all around the country. And I'm happy to report that primary care physicians warmly receive this product and are starting to order it for their patients. We've also invested heavily in a direct-to-consumer digital advertising campaign. So if you go onto the web and you Google Cologuard or CologuardTest.com, you'll be able to see a lot of information about colon cancer screening and Cologuard. So we've been able to reach across the country. There are 250,000 primary care physicians, and the team is working very hard to educate all of them.
All right. Now, the New England Journal of Medicine wrote a report. You mentioned it earlier. Can we bring that out a little bit here?
Sure. When we set out to do this, we said to ourselves, we're going to run a big, huge study and prove whether Cologuard works. And we enrolled 10,000 patients into a study, and in that study, Cologuard detected 92% of cancers, which was a 25% improvement over the other non-invasive approach, which just looks for blood in the stool. And it also detected 69% of the most advanced precancers. The idea is that these precancers take a very, very long time to turn into cancer. And with repeat testing, possibly every 3 years or so, provides the benefit that the test should be able to pick up precancers over time and cancer, again, at a 92% detection rate. It's really a breakthrough technology that enables early detection.
Is there anybody else in your field, and I doubt it, but I just need to ask this because I know the audience is thinking about this, that's anywhere close to what you guys are doing?
No, we're not aware. Other people have tried to detect colon cancer from a blood draw, and the problem with that approach to date has been a much lower ability to detect cancer and a much higher false positive rate. So it's very, very difficult to develop a test that is 90% able to pick up cancers with only a 10% false positive rate. There are no other technologies that can do that. The best technology for people willing to undergo it is colonoscopy. Unfortunately, too many people refuse to undergo colonoscopy for a variety of reasons. This is by far the best non-invasive approach to screening for colon cancer.
All right. Now, there's another report that was mentioned. I was going to save that for the next segment, but I wanted to open that up early. Maybe we can bleed into the other next segment. WebVest has done a little report on you guys, right?
Yes, WebVest has, and they have done an analysis that looks at the adoption, the projected adoption of Cologuard. We can't speak for any independent analysis, but we encourage people to read those independent analyses, including WebVest.
All right, because my understanding of this is, and I got a look at it last night, this is a sterling report that's just going to put you well ahead of anything that could even come up to try and duplicate what you're doing.
Well, Michael, we are focused on the important thing, the patient. You know personally how colon cancer touches people. It's a real disease. It can happen to anybody. Nobody is safe from it. There is literally nobody who is not at risk for colon cancer. We all are. It's about 1 in 17 people will be diagnosed with colon cancer in their lifetimes unless we do something to stop it. This is... Cologuard is a test that has been 20 years in development. The best minds in the country have worked on it, and we think this can just make a huge difference in real people's lives.
Your primary market for that, from what I understand here, is domestic. Is there plans to take this on an international basis?
There are. We have a team in Europe right now beginning to make Cologuard available in Europe. We expect to start offering Cologuard in Europe in the first quarter of 2015, so just a short time from now. We are also starting to build a team in Asia, and colon cancer is a worldwide problem. And again, the closest thing to a silver bullet in curing colon cancer is early detection. And you can only do early detection at a high degree of accuracy with either colonoscopy or, in our view, Cologuard.
All right, let's do this. We're going to go into a break here in the near in about a minute or so. Let's take a little one early and come back on the other side. Let's talk about the 2013, 2014 milestones you've achieved and what you've got coming up in the future for us, all right?
Great. Thank you, Michael.
All right, my pleasure. Exact Sciences, and you've been listening to Kevin Conroy, Chairman, President, CEO, Exact Sciences, and symbol on this company is EXAS. We'll be right back on the other side of this break. And special thanks to 1-800 Public Relations for all their media and PR support.
Center in Plano, we have a disabled vehicle tying up your left lane, 75 northbound, just before Parker Road. It is causing a slight delay to build from Park Boulevard, adding just a few minutes right now. Still working this issue out in Mesquite, 635 LBJ Freeway northbound, just after 30. It is causing some delays to stack up from Town East Boulevard. You're also looking at just about 5 minutes with an accident on your right shoulder. I'm Heather Anderson with your KFXR traffic.
Don't let bad weather add stress while you drive. Get Hyundai Blue Link with Service Link and SOS Emergency Assistance. Available on select models. Drive worry-free. Visit Hyundai.com.
Attention men and women. Are you suffering from back pain, neck pain, or joint discomfort? Would you like to learn of a non-surgical solution? Call American Medfix at 972-591-6675. That number again, 972-591-6675, to receive free info on how you may qualify for natural creams that may provide you with the relief you are seeking. All products are 100% made in the USA. Call now, 972-591-6675, or visit AmericanMedfix.com.
The Garage is a business accelerator and investment fund looking for new ideas in technology, manufacturing, and consumer goods. Our 90-day intensive workshops, taught by entrepreneur mentors, are focused on one thing: helping you make money faster. Each week, you'll experience a class taught by successful entrepreneurs with the guidance of experienced mentors in your field. We get you to revenue faster and help you find investors when the time is right. To learn why we're different, go to workthegarage.com. That's workthegarage.com.
Call Big D Cat's Catamarans for fun corporate events and private parties. Come celebrate with your special clients and build your team. Bring up to 85 of your clients and friends for dinner and dancing on the yacht, just minutes away from your office at Pier 121 Marina on Lake Louisville. Come sailing, golfing, target shooting for a fun yet elegant evening and cruise. You have to see this beautiful 70-foot catamaran. Check out the website at bigdcats.com. And to book your event today, call 214-705-3772.
Join us this Saturday at Prestonwood Polo Club in Oak Point as we present world-class polo right here in North Texas. Watch the thrilling sport of polo and thoroughbred horses racing down the field. Bring your family and friends and enjoy the traditional champagne divot stomp. It's the best tailgate in North Texas, so pack a picnic and join us this Saturday for world-class polo right here in North Texas. For more information and tickets, go to PrestonwoodPoloClub.com. That's PrestonwoodPoloClub.com.
More than the sum of our parts.
He caught it with one hand. Touchdown, Red Raiders.
More than stamina, talent, and strength.
It's intercepted at the goal line.
We are a team.
Inside 30, 25, 20. Down to the 15, 10, 5. Touchdown, Red Raiders.
And this is our year. This is Red Raider football.
The Red Raiders take on the Kansas Jayhawks Saturday, October 18th at Jones AT&T Stadium in Lubbock. Kickoff is at 2:30. The pregame show starts at 1:30 here on 1190 AM.
From the Mini Cooper Weather Center, today sunny and warm, high of 90. Tonight fair skies, low of 60. This report is brought to you by Pat Loeb's Toyota of McKinney.
2014 Tundra Crew Max Special Edition with approved credit. It's 2014 model closeout at Pat Loeb Toyota of McKinney.
Get 12,000 total savings on new 2014 Tundras.
Get it fast and fair at PatLoebToyotaMcKinney.com.
Welcome back to the Traders Network. I'm Michael Yorba, your host, broadcasting to you live from the Dallas KFXR 1190 AM Clear Channel Studios and iHeart Media Studios. All right, I'm talking with Kevin Conroy, Chairman, President, CEO, Exact Sciences, and symbol EXAS, exactsciences.com. And also, you might want to note this color guard, COLOGUARD test.com. This is a breakthrough technology. It's being noticed in New England medical. I'm having a tough time with that one, Kevin. Can you help me out with that?
New England Journal of Medicine.
Thank you so much for that. And also WebVest, an independent company, has also done a research report on this. And I'm looking at this report. Can we start off just a little bit on the WebVest report? Can you tell me a little bit about this? Let's go into that, and then let's talk about the milestones and things in the future.
Well, do you have any specific questions, Michael, on that report? I do not have that report in front of me.
Okay. I wanted to find out if you could bring out some of the key things that an investor would want to know of these different reports that are talking about your company, just on a high-level, general point of view.
Sure. I think these stock reports do a good job of explaining the product and the market that it has in front of it, to the opportunity that Cologuard has in particular here. Mm-hmm. And the WebVest report can give that background in terms of how the test will be adopted into the market, which physicians will use it, what the need is, and also provide some of their own independent projections for revenues and expenses. So these reports can be very helpful to investors as you take a look at them and really study them. In terms of how we progressed over the past few years, and yes, our stock has performed in part because we have, as a company, always set out just a few priorities each year, and as an entire company, everybody is focused and incentivized to achieve those goals. So in 2013, we just had a few goals. We had the goal of being prepared for launch. That means doing all of the work necessary to get the study completed, the clinical trial completed, submitted to the FDA, and published in a top journal. Our goal always was to have this published in the New England Journal of Medicine, which is recognized as the highest quality medical journal in the world. We achieved that goal, and we also achieved the goal of submitting to the FDA. In 2014, there was a very important event that occurred early in the year in April. The FDA hosted a panel of experts to review the data on Cologuard, and that panel voted unanimously, which is really a rare occurrence, voted 10-0 on safety and 10-0 on effectiveness and 10-0 on the balance of safety to effectiveness. So across the board, that recommending ultimately that Cologuard should be made available to the public. This was a big deal, and that combined with the New England Journal of Medicine publication, which doctors around the country and around the world read, really provided us with the opportunity to prepare for the launch of Cologuard and making Cologuard available to people and to physicians. On August 11th, for the first time in history, FDA and Medicare acted in concert. FDA approved Cologuard, and Medicare proposed a national coverage decision, which became final last Thursday. So as of last Thursday, Cologuard is available to all Medicare patients. For people who haven't been screened, if you're a Medicare patient, this is a big deal. 75% of the costs associated with treating colon cancer, which is about $14 billion a year, 75% of those costs are borne by Medicare. By detecting early, we can not only save lives, but we can also help reduce costs throughout the healthcare system.
Well, you certainly did. All right. Now, you've also been working with, you mentioned this earlier, but let's drill down just a little bit. Exact Sciences has been working with the Mayo Clinic and with Cologuard, and you continue to work together to bring out a robust pipeline of diagnostic tests, because there's more to you than just one product, even though it detects 92% of all cancers. And now you've reduced it by working with Medicare. This is just amazing stuff. Tell me about your pipeline.
Sure. Let me first tell you about the disease and how it's impacting people.
Please,
colon cancer is the number 2 cancer killer in the United States, second only to lung cancer. Colon cancer kills more people than breast cancer. It kills more people than pancreatic cancer, than stomach cancer, than esophageal cancer. When you take a look at the GI tract, the esophagus, you use to swallow food, your stomach, your pancreas, those 3 cancers together kill way more people than colon cancer does, which is the number 2 cancer killer. So we know that using these same molecular tools, these tools to let you detect cancers early, we can use these tools to develop new products that help in the early detection and diagnosis and ultimately then treatment of esophageal cancer and stomach cancer and pancreatic cancer. That's our long-term goal. Ultimately, we think these same tools can be applied to other cancers as well, including lung cancer, the number 1 cancer killer. So there are just an enormous number of opportunities. We're very fortunate to have the relationship that we do with the Mayo Clinic and other top academic research institutions around the country. That has been the secret to the team success. This has been a team effort. It's not just Exact Sciences. It's a number of leading gastroenterologists and cancer researchers in the U.S. and around the world.
Are there places that you're going to be present where people, physicians, or patients might be able to be at speaking events or anything of that nature that's coming up?
Sure. I mean, the easiest way for patients and investors to access more information about Cologuard is by going to Cologuardtest.com. Okay. There's a ton of information there. We also have a website called Be Seen, Get Screened. The idea is to get people out of hiding and into the screening population, into the willing people who are regularly getting screened. There's no reason not to get screened for colon cancer. It's a simple process, and it can save your life. We present frequently at investor conferences and other conferences. Although we won't be presenting, we will be attending the American College of Gastroenterology conference next week. Mm-hmm. And there's just a host of other conferences. You can always see that on our website, exactsciences.com.
People listening to this broadcast are going to want to be able to get their physicians involved in this. How would they go about waking their physicians up so more physicians can have access to these tests and this breakthrough technology?
Yeah, thanks, Michael. That's a great point. If you go to Cologuardtest.com, there is a form that you can download. It's just a PDF, one page, that you can print out and take to your physician and hand it to your physician, and it describes Cologuard and the very simple process for them to call Exact Sciences Laboratory and get signed up so that they can order Cologuard. It's a simple process. It takes a primary care physician 5 or 10 minutes, and we strongly encourage people to educate their physicians. Physicians are very receptive to the test. The evidence in from the study and the New England Journal of Medicine really makes them feel comfortable, but they also know there's this great need. There are just too many stories of people who have been stricken in the prime of their life by this disease, and physicians hate seeing that happen to their patients. It happens all the time, and they really want to be a part of the solution.
Got it. Kevin, we've got to bring the interview to a close. I really appreciate you taking the time and what you're doing for humanity.
Michael, thank you so much. We look forward to talking to you again soon.
Pleasure. All right, Kevin Conroy, Chairman, President, CEO, Exact Sciences, exactsciences.com and Cologuardtest.com. Symbol on this stock, EXAS. And special thanks to 1-800-Public Relations for all their PR and media support. We'll be right back on the other side of this break with Joseph Pandolfino, CEO, and Henry Segarnio, President, CEO, Chairman of 22nd Century Group.